So what exactly is an autopsy? What does it consist of? I am Dr. Wolf. I am a forensic pathologist, and I'm going to talk about autopsy today to basically alleviate maybe some misconceptions and kind of talk about what the procedure really is. Now, I thought to do this because in the last 2 or 3 days, I've gotten thousands of followers from Africa, specifically Nigeria, who have commented many times on my posts about, performing autopsies because there is a very popular rapper there named Mohbad, and I don't know if I pronounced that correctly, but he died, and there's some questions around his death. So I've had people ask me about autopsy, but I've also had a lot of people say that, we're sad that he has to suffer, that he has to go through this. This is terrible. And I want to say that I don't really see it as a procedure of suffering. And so I want to explain exactly what happens without too much detail. What is an autopsy? So autopsies can come in different forms. The first is really what's called an external examination, where you don't even open the body. You just look at the body, you describe it, you describe things that are like identifying features such as eye color, hair length, presence of tattoos or piercings, the clothing they were wearing, and any presence of injury. And then a lot of times, most times, you will also draw toxicology. What that means is you take fluid from the eyes, sometimes the vitreous fluid, you'll draw blood and maybe even urine, and you send that to a toxicology company to see if they can find any substances in there that shouldn't be there. All autopsies have the external exam portion, regardless of how much more you do after that. And during that portion, usually there are photographs taken for the record to document the evidence. Now, at that point, you can choose to do a partial autopsy or a full autopsy. So a partial autopsy is one that is focused on a certain area of the body. So very commonly, what I might see is somebody who, let's say they come to the ER in chest pain, they die, and we know that the cause of death is most likely in the chest. It's going to be related to the heart, the blood vessels, or the lungs, typically. So sometimes we can do it as a partial, particularly if there is a strong objection by the family to continue to do more. Okay, but for the most part, a partial will be chest or chest and abdomen organs, or sometimes it can be just the head if the cause of death is apparently just in the head. Now, those would be partial autopsies. Those are not as common as the full autopsy. The full autopsy is the surgical portion of the exam. So an examination involving organs of the head, neck, chest, abdomen, and pelvis, and any other area of the body that needs to be looked at in order to arrive at the cause of death. So ultimately, the goal of the pathologist is to arrive at the cause of death. And the cause of death is a specific diagnosis. So that would be something like heart attack, pulmonary embolism, ruptured brain aneurysm. It would be like something like electrocution or drowning or a gunshot wound or a stab wound or poisoning. So those are all specifics. But we also have to assign the manner of death. And the manner of death is a category. So that can be one of 5 things. In the United States, we usually have 5. There's sometimes a 6th category. But we have accidental deaths, natural deaths, suicide, homicide, and then when no manner can be settled upon, there is an undetermined category. There's also in some states a 6th category, which is deaths occurring during a medical procedure or due to therapy, that type of thing. That's not one that is in my state, so I don't use that. But that is the main way that we categorize those. So what exactly are the concerns for people who are objecting to autopsy? So the main objection is a religious one usually, and that those individuals, either it is dictated by their religion to not touch the body, or it is simply viewed as a type of desecration. But that's, I think, because there is some misconception about what we do. What we do is actually quite precise. It is surgical, and it is done in a way that is meant to preserve the integrity of the body